All right, we are live.
Well, thank you, everybody, and thank you for joining us this evening. This is our third in a series of town hall meetings designed to keep the public informed about the COVID-19 situation, testing, vaccinations, trending, and everything else that matters to the public. So we have a few things that we need to do for housekeeping, and I'm going to introduce Josh Morgan, my communications manager, to let everybody know how they can access different parts of the seminar. Josh?
Thank you, Mayor Rilling, and thank you to all the members of the panel for being here tonight, and for members of the public for tuning in. So just a little bit of housekeeping for everyone. Folks who are watching on Zoom will be able to participate by entering questions into the Q&A box on the bottom of your Zoom screen. Simply click on the bubble icon for the Q&A at the bottom of your screen. It will open up a box and allow you to type in your question. Questions from the public are going to be presented to the panelists and addressed throughout tonight's town hall meeting. Tonight's town hall is also being recorded on Zoom and on the City of Norwalk YouTube page, and it will be later posted on norwalkct.org and local cable access for reviewing. Tonight's town hall is also being presented in English with live interpretation in Spanish and Haitian Creole. Simply hit the interpretation button on the bottom of your screen to select your preferred language. This meeting is also being presented with American Sign Language interpretation, which will be shown on the screen at all times. Thank you, Mayor Rilling. Thank you again to our panelists for being here tonight, and I look forward to a great conversation.
Thank you, Mr. Morgan. Well, we are very fortunate tonight to have a very distinguished panel. First, we have Dr. Reginald Eady, President and Chief Executive Officer at Trinity Health of New England and co-chair of the Governor Lamont's COVID-19 Vaccine Advisory Group. Welcome, Dr. Eady. We are very pleased that you could join us and very honored. Also joining us this evening, we have Dominique Johnson, Councilperson at Large of the Norwalk Common Council, Councilperson Greg Burnett, Councilperson at Large of the Norwalk Common Council, Deanna Diamore, our Director of the Norwalk Health Department, and Lamont Daniels, who is my Chief of Community Services, who will also moderate tonight's forum. So first, let me update people on the situation here in Norwalk. The good news is that effective tomorrow, every person over the age of 16 will be eligible to receive a vaccination. We are seeing, however, the bad news, a bit of a rise in cases, especially among the group ages 20 years to 40 years of age. So we want to remind the public that it's still necessary to remain vigilant. We need you to be cautious. Only go out when you need to go out. Don't participate in large group activities. Please be sure to wear your mask. Please be sure to wash your hands frequently. Keep your distance. And those are the things that science tells us has worked, continues to work, and will continue to work, and will be necessary for still a bit of time. The COVID-19 task force that I put together has been working to provide communications, education, and most importantly, vaccines to the community. As you also know, we have various testing sites around the city. And if you go on the city website and look at my daily briefings, you will find where those locations are. Also, as you know, every Wednesday morning down at Calf Pasture Beach in partnership with the Connecticut Food Bank, we provide food to people experiencing food insecurity. Unfortunately, that is still a problem here in the city of Norwalk, in Fairfield County, and indeed all around the country. So as I mentioned, tomorrow the vaccine eligibility expands to everyone. About 1 million people will, in the state of Connecticut, will become eligible. And we believe there's going to be a rush. So we're asking for your patience and stay tuned for some special plans we have to bring the vaccine to the Norwalk community. We've already brought the vaccine out to different churches, and we have great plans to bring the vaccine to the people, especially the people that can't get to the vaccine. So without further ado, I just want to thank our panel for joining us tonight. And I'm going to turn the floor over to Mr. Lamont Daniels, my Chief of Community Services. Mr. Daniels.
Thank you, Mayor, and good evening. Good evening, Norwalk. I'm Lamont Daniels. I'm excited to be here again, also to serve as your moderator. As the mayor pointed out, we are very honored to have with us Dr. Reggie Eady to be with us. And welcome to Norwalk. Thank you for joining us in our city. We really appreciate it. So the plan tonight is simple. The goal is simple. And what we really hope to do is to do a couple of things. We want to talk about what we've been doing in Norwalk, and what, to the mayor's point, what we've been preparing for it within the next couple of hours, April 1st. And we'll love to get Dr. Eady's perspective on that. And also we'll engage our common council leaders, our local leaders, and hear from our health director, Deanna Diamore. But Dr. Eady, thank you. Let's do this. Thank you for coming to Norwalk again. Can you just share a little about yourself so Norwalkers know who you are and why we keep on saying it's an honor and it's a privilege to have you in our city? You're a leader in the state, co-chair, advisor to the governor. Welcome. What would you like folks of Norwalk to know about you tonight?
Yeah, I won't spend a lot of time talking about me if that's okay. But so Reggie Eady is my name. I am honored to be participating today. Thank you, Mr. Mayor, for the great work that you've done. I got exposed earlier to some of the stats that you guys had at a vaccination site at a church yesterday, and those are phenomenal numbers all across the board. So congratulations and thanks. So my wife and I are new to Connecticut. I think we can no longer call ourselves new. We celebrated our 3-year anniversary on this past Saturday. So we're delighted to serve in the state of Connecticut. I was fortunate enough to be tapped on the shoulder by the governor, along with Commissioner Gifford, to co-chair the Connecticut Vaccine Advisory Group. And so that work has been ongoing since about September, believe it or not. And I'll just stop there. It's a delight. It's a pleasure. And I am at your service in any capacity I can be. Thank you.
And thank you again. So let's talk about that. I call it, you've been in the situation room around, you serve as the co-chair, you're advisor to the governor, talking about the vaccine, talking about the vaccine distribution strategy. I think a big piece is communicating the information. Right. So let's begin with, just from your perspective, you've been in the room, you've been advising. What has been most important to you as the co-chair, as a member of that group? And what's been your perspective, and what's been issues that you want to make sure in that space you've been able to articulate to ensure, our community know the importance of the vaccine?
Yeah, sure. Thank you. So, I think what's most important to me is what's most important to the governor. We started off back in around September, even before a vaccine was available. The current administration at that time, I should say, advised each governor to create an advisory group. He then tapped myself and Commissioner on the shoulder, as I indicated. And we were operating under essentially 3 goals. One, to get as many people.
Are you able to hear him, Mike? Are you able to hear him talk?
Mayor, you're not on mute. We can hear you.
You guys can hear me, correct?
Yes, sir. Yes, sir.
Great. So we were advised to get as many people vaccinated as quickly as possible, as safely as possible. And then third arm to our goal was vaccine equity. And you guys know Connecticut has been declared a gold standard across the country as it relates to our vaccine initiative. So we're very proud of that. But there's still a lot of work to do. A controversial decision that was made by his committee was, remember initially and I just want to address that now. Remember, initially we started off following strictly the CDC guidelines. But when we realized that 90+% of the deaths in the state of Connecticut were amongst those that were 55 and older, we decided to stop the line and create our own strategy separate from the CDC. And that's sort of when we developed our age-based strategy. And we also realized that had we gone with the original plan of the CDC, that is things like bringing in comorbidities and staging, we would never have reached tomorrow. And tomorrow is a great day for the state of Connecticut. We continue to lead the country as the mayor indicated, those who are 16 years old and above are eligible. And we did this very, very quickly, efficiently. And the only rate limiting challenge or step that we have to deal with is the availability of the vaccine. That's the only reason why there are people in the audience who've not been have access to a vaccine. It's not on us, it's on the manufacturers and everything else that took place prior to us getting to where we are today. Let me just make a couple more comments and I'll be done here. So just as a reminder, as of tomorrow, April 1, there's only one vaccine that has emergency use authorization for those that are 16 and 17. That's Pfizer. At this point, Moderna and Johnson & Johnson have not yet asked for emergency use authorization for those under 18. So I wanted to throw that out. Vaccine equity remains a challenge. Clearly, under the mayor's leadership, you guys are addressing that, again, based on the numbers that I heard yesterday. But we need help across the state to do that. So you guys are role modeling that. The last thing I'll say is just want to do a quick reminder, and I don't know how far we'll get into it in the Q&A, but just a quick reminder about the 3 vaccines that are available. So Pfizer is messenger RNA based. It is based on the spike protein. Remember, there are 2 injections 21 days apart, and you're not declared fully vaccinated. So when you hear me or read about people saying fully vaccinated, we're referring to the 14-day period after the final injection. And I say final injection because obviously there's 2 for Pfizer. Moderna is essentially the exact same vaccine. The technology is the same. The solution base that they use is slightly different, which is why Pfizer has to be stored at a lower temperature. But otherwise, they're essentially the same. The efficacy for both of them is about 95%. The last thing I'll say is just on Johnson & Johnson. It's a 1 injection regimen. 14 days after that is when one can be declared fully vaccinated. And then the controversial part about Johnson & Johnson is the so-called lower efficacy, which in my opinion, it is not a lower efficacy at all. And here's why I'll say that is because the difference between Pfizer and Moderna was when the clinical trials took place and when they were tested and then administered throughout our state, there were no variants. There was not the UK variant, not the South African variant, and now there's many others in the state of Connecticut and in our country. So the Johnson & Johnson researchers did put that vaccine up against the variants, which if you think about it, it's a tougher a tougher journey to undergo because now you have multiple mutations or multiple variants. And that's the only reason why it appears as if from an efficacy perspective, the Johnson & Johnson is inferior. But I will tell you that if we put Moderna and Pfizer up against the variants early on, we didn't because the variants weren't available, then I would argue that the efficacies would be just about the same. I'll conclude with reiterating what your mayor said. Listen, this is not the time for us to sort of let our guards down. Because of the variants or mutations that exist, we see an uptick in cases in the state of Connecticut. Now more than ever, I mean, we're heading out of the tunnel. There's a light at the end, but we're still in the tunnel. So we've got to wear the proper masks. We've got to wear a mask that's medical grade or multi-layered. We have to social distance at least 6 feet apart and practice proper hygiene. That's a lot. I'll stop there. Thank you.
Fantastic. No, thank you. So, but let's build on that. You know, I read in one of the papers, and I hope they quoted you correctly, that you were quoted saying you have full confidence in the safety and efficacy. And you kind of spoken to and alluded to it, but I want to make it more personal because those that are watching us tonight, and then as indicated earlier, this will live on our YouTube page and so forth. So residents will have an opportunity to watch this. We know that the mayor indicated this is our 3rd conversation, and we have received positive responses from Norwalker saying, you know, because of that video, because of you had on the panel, I decided to then make that next step. So can you talk about, you know, what did you mean by that if you have full confidence in safety in the efficacy, and what would you say to Norwalkers who are still on the fence? I'm sure you've heard, you know, I'm going to still wait and see. Can you speak to folks who are saying, I'm still not sure, I'm still not convinced? From your expertise in where you live, work, and play, how would you respond, and what would you say to them?
Yeah, so I think I'll start by just reminding people that, listen, they're all based on this, although we call it a novel or new technology, this RNA technology, it has existed for at least 10 years, right? So that's why it was produced so quickly. You know, it takes about 6 years on average to produce a vaccine in this country. We did this in less than 12 months. So I understand, but what we need to do before we jump on the fence and just sit there, if you will, we need to get our concerns addressed and our questions answered. And so conversations like this, do just that. For people who say that I'm waiting to see what happens, or I'm just going to wait a little while longer, let me just remind you of what you're waiting for, right? You're waiting for the possibility of being exposed to the virus. You're waiting for the possibility of getting infected and infecting some of your friends and family members who may not have a good outcome. You're waiting for possibly being hospitalized, or waiting for possibly being placed on a ventilator. And unfortunately, it's still over 1,000 people dying a day. And we cannot afford for one single Norwalker to be waiting for that. So I encourage you, and God be my witness, and research it yourself. The Pfizer, Moderna, and Johnson & Johnson vaccines are highly effective. They're very safe, and they're of high quality. And it was the gift of God that we had the mRNA technology available. And that's the only reason why we were able to get the vaccine within 12 months. Had we not had that technology, we will be waiting 6 years. And I can promise you, had we had to wait for 6 years before a vaccine was available, many of the Norwalkers would not be alive to see the date that the vaccine becomes available in the state of Connecticut. And it is, and we have 3. So it is our responsibility to ensure that we protect ourselves and the ones that we love. And the only way to do that is to reach herd immunity so we can get back to some degree of normalcy. The only way to reach herd immunity is twofold. One is by passive exposure. That is waiting to see how long it'll take, which will be another 6 years, if you will, for this country to develop herd immunity. That is about 80% of us being immune to the virus. The only other way to do it, because there's only 2, is through vaccination. Again, vaccination is the safest way and the fastest way. And the vaccines that we have available per the FDA and the CDC, and what we've seen in Connecticut and in our hospitals across the country, all over the globe, is that they are very safe and very effective to ensure that you don't not only spread the disease, but won't 100% guaranteed need to be hospitalized or die from coronavirus. I can't think of any better reason for people to make that decision and make that decision now.
Well said, and I'm looking forward to that. Once this get posted, folks can hear. So last question before I bring in the other folks, how is the state doing? I mean, obviously from a local perspective, we rally all our resources. Can you just speak to one of the things we find in Norwalk, and I would imagine both from across the country, I'm sure, where you see is competing with the misinformation. Yeah. It's out there, it's fast, and the public, I saw it on Facebook, I saw it here, and it's believable. How can you just talk to, what is the state doing, or what could we do more of from your perspective around combating this information? Because I could tell you stories what people say, yeah. Unfortunately, and I know you may know them, but how can you respond to that? What would you share?
I think the state is doing the best that it can. And I say that because, and I'm looking at the data, right? So we are one of the top states in that as soon as the vaccine lands in our state, we get them in the arms of our residents, our citizens, much faster than all the other states. Maybe 2 or 3 do better on a consistent basis, but that's it. So yes, we have to deal with these false narratives, these falsehoods, these untruths. And as your mayor so eloquently said, it's all about following the science. So I would charge everyone out in the listening audience or viewing audience, just one thing, before where there's a question mark or a concern, let's just make sure we get you access to the answers to your questions or the addressing of your concerns. And I promise you, if we do that and we do that adequately, which sometimes is the challenge, because we think that we're smart enough to know how to best answer your questions or address your concerns, when we should be listening to you, partnering with you, and making it easy for you to get the information the way you want to get the information. But outside of that, I think I can't think of a better state to live in the midst of a pandemic than the good old state of Connecticut.
Oh, we like that. We like it. Appreciate it. So we're going to bring in some of our panel members. Council Member Burnett, will you join us? And Dr. Edie, you are our guest, so I will be directing some questions to the panel or our local leaders, but by certainly, if you want to weigh into some of that conversation, I will kind of also redirect and ask you if you have any input, feel free. Councilman Burnett, thank you. I actually have a specific question for you because you serve as an emergency volunteer. So, you're on the front lines. You've been in the clinics, you've seen it. And I guess the question that I would love for you to speak to is, one, what has your experience been like? So Norwalk can get a sense of that. And just anything you want to share from the experience. I know you yourself have received your vaccine. I have too. So we're asking people to disclose whether they got vaccinated. It's not a secret. I'm still okay. I'm my 14 days, so I'm fully vaccinated, Dr. Edie. And so we post our information online. But Councilor Burnett, you're there. You're at the clinics. What's your impression, and what can you speak to kind of calm people's expectations and quite frankly nerves, because people are saying, I'm not really sure, I don't know if I want to do it. What do you have to say about that?
Well, thank you, Lamont. Well, I think first of all, everyone that has an appointment, because that's a challenge in itself. But once they have an appointment and they come to the clinic, they're very positive about going through the process of getting vaccinated. And our vaccination team has done an outstanding job under Deanna's leadership in making sure that experience is quick, stress-free, and the people that leave that vaccine clinic are so elated about the experience and the fact that they've received the vaccine. We review each and every clinic and make the necessary changes so that each and every clinic is better than the previous one. So the experience has been very positive. Everyone's been up-spirited in terms of the opportunity to receive the vaccine. And we try to make the experience one where they're very happy about relieving that stress of not having the vaccine. I think that's one of the key things. It brings a certain peace of mind that they now have the vaccine. It's not to say that they cannot get or catch the vaccine. However, as indicated, they won't end up in the hospital. They won't end up on a ventilator. And I think that brings a certain peace of mind and relieves a certain degree of stress that prior to receiving the vaccine, several of us have experienced. So that's the important message that I like to share about the positive nature of receiving the vaccine.
Fantastic, thank you. I'd like to join us, Council Member Dominique Johnson. Good evening.
Evening, how are you, Lamont?
Good. So I participated with you on a call around identifying how do we, and Dr. Edie alluded to it, so we're going to build on equity, but I also want to define it because it's a very broad term, and that's kind of the language we use internally, but the average person, like, it doesn't mean anything to them. But, you know, what have you been working on, and what's important to you as you think about, and Dr. Edie would love to bring you in, actually less than 24 hours, because I think everything goes live at 12:01, that, you know, I think over another 1.8 million people will have access. So, you know, how are you thinking about it? And then Council Member, I'll bring you in the end, but definitely want to hear from Dr. Edie. How are you thinking about it from your district, from your community? Because, you know, this is going to be a big moment, right? You know, in the next couple of hours. What are you thinking, Council Member Johnson?
Well, I'm going to be one of those 8 million people?
Something like that. I saw
something like that.
I'm not sure.
In about 3 hours.
I know it's a lot of people.
Yeah, I'm very, to echo my colleague, Council Member Burnett, I'm very much looking forward to that moment where I'll be able to be vaccinated. It will be a moment of something I'm really excited, because I know that a lot of my friends and families and neighbors have gone through that process and have talked about and echo how smooth and seamless and elating it is to know that you can avoid, as Dr. Edie said, these horrific outcomes that so many of us know, folks who've battled this disease. I'll say that we're really looking forward now to this moment where not just age, but we can expand access to the vaccine in all these different ways, especially here in Norwalk on I have to give a big shout out to Representative Stephanie Thomas here, who's been leading this movement over the next month to get some clinics in the city and add to the wonderful work we've been doing here in Norwalk to reach out to folks who haven't yet had access to the vaccine in an equitable way, whether it because of timing or scheduling or access literally through transportation because of where the sites are. And so Representative Thomas has brought together wonderful community groups, and I'm really happy to be involved in this work to bring together particularly a clinic for BIPOC residents in Norwalk, specifically in zip code 06854. And so that's for Black, Indigenous, people of color, specifically that community of folks, as well as Hispanic Latinos and Asians and Pacific Islanders, to get access to the vaccine. No insurance is needed, it's free. And of course, it'd be available to you regardless of your immigration status. And so for 18-year-old Norwalkers and up, this will be for you and your chance to have something that is more accessible to you. So I'm really looking forward to all the community coming together. That's really what this is we're looking out for each other all through this crisis. And this is another way we can do that, is continually try to expand who has access to this vaccine.
Great, thank you. Dr. Edie, a follow-up, you mentioned it a little bit earlier in our conversation, I don't know if this is the appropriate phrase, the state of Connecticut, we kind of diverted to our own CT plan. Right. And let me play both sides a little bit. I know our numbers are great, and I know you are aware of some of the strategies we've done working with our faith-based community, but we also have to stay honest with ourselves that we got to do more and get better. I think Councilor Burnett kind of alluded to that. So, it's going to be open up, and I think it's one point, I read that somewhere, but that access thing we started talking about a little earlier, because I'm personally aware, it's interesting that, there's these new terms, vaccine hopping. Once we post it on the website, literally, I know people have tagged vaccine on their personal email. So if something pops up, and we've done our own kind of closed clinics to try to target, but can you just speak to, or even for us, and I'll bring in our health director, how do we do that to ensure to, kind of Councilor Burnett kind of mentioned, and you raise it as well, to making sure, which goes to this word equity. What does that mean to you, and how important it is, and how are you thinking about it in our state?
Yeah, I'm just going to be lifting up what the previous panelist, Dominique, said. I mean, I think Dominique hit the nail on the head. So let me take a step back. So, I don't understand how the vaccine works. I don't really understand the side effects. I don't understand how the virus works. All those things do not equal vaccine hesitancy. In fact, I encourage the participants to Google the definition of vaccine hesitancy. Remember, the definer is the World Health Organization, not me, not a commissioner, not a health expert, not Dr. Fauci. It's already been defined. And it says something like this, which means that we have to be careful when we declare someone being hesitant. I mean, we were calling Black and brown communities vaccine hesitant before there was even a vaccine, which is very unfair, because we all know, especially the sociologists in the audience, when you tell a child that he or she can or cannot do something, they start believing it. And the same thing applies to adults, especially in a scary pandemic. The WHO definition of hesitancy says something like someone or a group of people will delay or resist getting vaccinated, here's the key, in the midst of adequate vaccine access. And so Dominique's point is that there's a challenge with access. Our problem in Connecticut is not vaccine hesitancy. And I know this is controversial because we have legislators who don't support this, but I'm going by the science, as your mayor suggested we should always do. We're not hesitant in brown and Black communities. We just need to better understand what the heck is going on. And until we deliver that message, like we're doing today, very good, until we deliver that message, of course, people are going to have question marks, right? In more affluent communities, that they have access to that information more readily than the vulnerable community. So that's what we're dealing with. It's all about access, right? Essential workers, and this topic, it brings out the passion in me. So I'm going to stop after this. Let's think about an essential worker, right? Let's think about someone who, remember the previous president mandated through the Defense Act that people working in meat packing plants have to go to work. It was a mandate. So let's think about that. So meat packing plants are open up early in the daytime. Many of them close during banking hours, right around 5 o'clock. Many of these essential workers who live in multi-generation households, so that's a risk for spread right there, they may have to take public transportation to get to a vaccination center. The vaccination center, by the time they get there, is closed. So that's the problem. It's not that they're hesitant. They don't have fair access to the vaccine. So therefore, the vaccine distribution throughout the 169 cities or towns in the state of Connecticut, it has to be done in an equitable manner. It has to be fair. we have to consider the barriers that the system has put in place for such residents, not the residents. The system created these barriers. So we have the responsibility, if we really care about equity, to consider the barriers that the system put in place and to make it easy for such populations to get access to the vaccine. That has not been happening to the extent that it should in this state. But listen, the numbers are improving every single day. You guys are contributing to it, what you had at your church yesterday. But these conversations are very, very necessary so that everyone in the state can understand why our numbers are so skewed as it relates to non-communities of color versus communities of versus white communities. And we've all contributed to that. Now we have the responsibility, because this virus, God made it fair. You can't leave one single community behind, because if you do, we will be in the midst of a pandemic forever. And the only way to get out of it, if we reach herd immunity, that is 80% of the people in Connecticut, 80% of the people in this country across the globe are vaccinated, regardless of your skin color and your social economic status. And that's what equity is all about.
I appreciate that. So we're going to bring in our rock star, and that's none other than Deanna Diamore, which is the health director here in the city of Norwalk. Dr. Edie. Hi, Deanna. Good evening. Good evening.
Good evening.
So I know we talked a little bit, but I'm gonna put you on the spot a little bit, you know, because we're amongst friends here. But just and we talk a lot. I mean, you heard a lot just from where you sit as our health director in the magnificent work. You know, what are some of your takeaways of just what you're hearing right now?
I love hearing what Dr. Edie is saying about the system, and we have to look at the systems that we are creating, that we're using, and how what that impact is. And so I'm gonna be very honest, you know, when we've had clinics using the VAM system, we would notice that very affluent, you know, coming from affluent communities coming to our clinics, not seeing a lot of diversity. So we saw that, you know, we saw that the system that was in place was going to be favorable to those who had the technology access. And so we very quickly recognized that and wanted to address that and to do whatever we could to, from our perspective, the systems that we're using and what we're doing, how can we create equitable access? And so, you know, from seniors not being able to access technology and working with you, Lamond, and the Senior Center and the Senior Services Coordinating Council to be able to have referrals to the health department so that we can call people and schedule them. Thinking about moving forward using, you know, our own electronic health record system for scheduling, because it's a little easier than using the VAM system. Just creating, and it also, we can do that in English and Spanish. Thinking about the materials that we're creating, thinking about where we're delivering that vaccine. And it was really important to us to have a location that was accessible to many members of the community. And that's why, you know, we were searching over South Norwalk, and we're so excited about this new partnership that we have with Bowtie Cinemas to offer at the Sono Regent Theater, to be able to be in South Norwalk and to, you know, be able to be in a place that's more accessible. So, you know, I think, you know, it's really important that us as leaders be able to recognize these issues and do whatever we can to address them. And I'm so thankful to all our community leaders and community partners who are helping us with this, because it really takes a village to come together to be able to address this and to be able to vaccinate our community.
Awesome. Dr. Edie, I'm gonna bring you in with Deanna, and either both of you could probably tag team this, because we are getting some Q&A from the public. So I want to thank the public for joining us tonight. And if you have some questions, we'll work very diligently to respond to many. But there was a question around access, specifically around some folks. There's a couple of questions that people are saying they're seeing more Pfizer and Moderna available, but they really want Johnson & Johnson. What would you say to that?
So, yeah, you know, I please don't quote me on this, because a colleague of mine, our chief clinical officer for Trinity Health New England, said it in passing when I was coming to literally log on to this webinar, that Johnson & Johnson apparently had a manufacturing issue, and we should learn more about it probably tonight on one of the news stations, to the extent it's true. That's why I don't want to be quoted. But listen, I completely understand why people are attracted to Johnson & Johnson. Listen, I got my vaccine on December 21st, because I'm an emergency medicine physician, I was eligible for it. My second shot was 21 days later. Efficacy is 95%. I was cruising and very, very happy that I got that lifted the stress off of my chest, because I was concerned seeing thousands of people die every single day that I would be a victim. But then Johnson & Johnson came, and that efficacy is pretty strong. It's been compared to the variants or challenged by the variants. And if I could rewind the hands of time and all three of them were available, I would likely, because I mean, who likes to get injected? I would likely do Johnson & Johnson. But my recommendation to the audience is just take whatever is in front of you. We're having a Vaccinathon on next Friday from 5 p.m. to Saturday 5 p.m., 24 hours here in the north end of Hartford. We were banking on getting a lot of Johnson & Johnson, so we don't have to schedule the second appointment. We schedule our appointments while you're waiting that 15 minutes after your first injection for both Pfizer and Moderna. We'd much rather just give out one, let people go on, and we can walk them through any side effects or concerns or questions they may have before, during, and after the vaccination. But in the face of a limited number of Johnson & Johnson, we've been waiting for Johnson & Johnson for a couple of weeks now in Connecticut. We were banking on a big influx of Johnson & Johnson over the next 2 weeks. I don't even know if that's going to happen. So take whatever's in front of you. Do not wait for Johnson & Johnson, because again, you could be waiting for all those things we talked about. But in the event you have all three in front of you and have a choice, I would not support that Johnson & Johnson is inferior to Moderna and Pfizer.
Indiana, your message has been exactly the same.
Yep, exactly. Great. Whatever vaccine you can get, take that opportunity.
This probably is more directed to you, Dr. Edie, to your role as co-chair. Again, just trying to read it. So, and paraphrase it. The vaccine supply, it appears that the demand is outweighing the supply, and people are concerned with the April 1st opening up. How long do you think they will have to wait? I don't know if you have that answer, but if you could just speak to how the state is going to work to increase the supply, given the demand and the extended April 1st, which is tonight, to a larger population.
Yeah, so that's tough. That's tough to answer, only because, again, the rate limiting fact is the availability of the vaccine. However, I'll say this. The president of the United States said that there will be enough vaccines in the country for all of its citizens by the end of May. So therefore, between now and May, as the mayor suggested, we need to continue to wear the right kind of mask and wear it properly, social distance, practice good hygiene, and just stay alert, keep your sort of ear to the ground, check ct.gov, check your city's website to see when vaccine availability is going to increase in your communities. It's coming. There's a massive amount coming to the state of Connecticut. It's just a matter of it getting here. But once it gets here, we do a great job in getting it into the arms of our residents much faster than most states.
And Dr. Edie, this question comes up because I've been a part of all three in some respect, comes up all the time, but I love how every time we ask a doctor or a professional or expert in this, I love how everyone has a different nuance, because I'm a firm believer, people will connect to who they connect to, and that may be that point. So the question is around the antibodies. We're getting a lot of questions around, I had the virus, do I really need to then get the vaccine? They, feel like they have the antibodies and they are protected. This is what people are hearing. I see you nodding your head. Could you speak to that?
So I did this is a great question, and this is how God works. So I did a panel discussion at Quinnipiac on yesterday. You can go to the website and view it, but I can't disclose the person's name because I don't have permission to do so. But one of the panelists said that he had COVID-19 twice. Both times he was very, very sick. What I don't know is if he has any chronic so-called long hauler side effects. So let me explain that just very quickly. So I usually say that there are two V's in this story. You're either going to get the virus or you're going to get the vaccine and not have to worry about the virus. Or you could have had the virus, but because, just like the panelists from yesterday's Quinnipiac discussion, he got it twice. And so what that tells us and tells the scientists is exactly the answer to the question. That is that just because you've had the virus does not mean that you're going to have long-term immunity. So that's why people are getting it second and third times. And listen, the people who get it second and third times don't necessarily do better because they've already had it. So we don't want to take that risk. What we do know, though, that is if you get vaccinated, not only will you not have to worry about dying or be hospitalized, but now we know you won't be a carrier. So that's great news, because we weren't sure about that. The science hadn't answered that question a few months ago. We did not know the answer to it. But the good news is that your immunity will last at least, because remember, the clinical trial started back in the middle of last year between the first and the second surge. So we know that once you're vaccinated, your immunity will last at least around 12 months so far. Measles, mumps, and rubella, that lasts a lifetime. The flu, it only lasts a few months. And that's why the flu vaccine comes every flu season. It's an annual injection. So right now, it looks like this may not need to be an annual injection. It may be every other year, or hopefully it'll be like measles, mumps, and rubella, and it'll be a lifetime immunity. But we don't know that yet. But I think the point is, though, that you're hearing all the good reasons to get vaccinated. Jump off of that fence, land on the side of the vaccination line, roll that sleeve up and get vaccinated. That's the take-home message.
I like that. Jump off that fence, Norwalk. You heard it from me. One more question. And there's a lot of questions we have are being directed to you, Dr. Edie. So the New Haven Register, and it actually ran down here, Yale Hospital has 6 children, I think, or 6 young people. I think it was young, and 2 are in ICU. Do you have a perspective on that, or just some thoughts? Because people are concerned and people are starting to talk about that more around children. I know 16 and up. I'll let Deanna talk about some of the things we're doing with our school, but just there's some parents here saying, should they be concerned? What do you can you give some thought or perspective to that?
Yeah, we predicted this would happen. So remember, I told you we switched from the CDC's recommendation to an age related, because the majority of the people 55 and the majority of deaths, I'm talking 95 and greater in the state of Connecticut at that period, were 55 and older. So now that group, about 80% of that group has been completely vaccinated. So we're not seeing that many people die in that age group. And they're not carriers, they're not getting reinfected because they've been vaccinated. Now we see the age going lower and lower and lower, which is worrisome. And remember, the reason why the 3 big manufacturers only asked for adult approval, except Pfizer, 16 and 17 years were included, because that's who was being infected the most, and that's who was dying. They're all now going back, trying to bring in or get approval to bring in those less than or equal to 18 years old. So it's just a matter of a few months before that will happen. But until then, I would advise, if you have a 16-year-old child who's in high school, or a 17-year-old kid who's in high school or college, whatever the case may be, I would have the conversation about getting vaccinated with them, because we're now seeing increase in hospitalization, a severity of illness in kids that are less than or equal to 18 years old. And that's the problem, right? We're taking care of the teachers, so that's great. Now it's just a matter of you making sure your child protects his or herself. And it's hard for an 8 or 9-year-old to go to school and comply with all the great things that we've talked about in terms of recommendation, right? They don't really completely understand it. And we understand that. But the moment that the vaccine is available for children, I think we're seeing good enough reason for us to get our kids in line as quickly as possible as well.
Fantastic. And there's a question around where could we find good information? I remember one of our panelists, the doctor, said anything with a .gov on the website. Do you have anything to add to that in terms of where can people find reliable and accurate information around vaccine, just so they can better educate and inform themselves and in their loved ones?
Yeah, so I would say a couple things. One, the difficult part about the many intelligent people we have in the state of Connecticut is somehow they can't deliver this scientific message in a way where everybody can understand it. So that's one thing you've got to look for. Find someone who can take this fancy DNA, RNA, the science, the way the cells work, and break it down so that people can understand it. So that's one. Two, I think there's so much being said in this conversation that like a favorite, I was going to say album, just telling my age, CD, like a favorite, I don't know, what do you call them nowadays? Your favorite artist, and you listen to those songs over again. This is probably going to be worth you going back and listening to it a couple more times, because you can start unpacking a lot of your concerns and questions, because this is a lot of information. I totally get it. And you can't write it down fast enough. I think the state, local, city, and state websites, that information, as long as it's scientific based And that's the key, right? If it's a Dr. Fauci conversation, I will listen to all those. I respect him a lot. Don't know the man, but I challenge a lot of things that he said, and I support him 100%. What you don't want to do though is indulge in a conversation that's not scientific based. I'm not on social media, but my understanding is that a lot of these narratives are generated and perpetuated via social media. That's why I don't even participate or engage in it, because I don't want to my thoughts in any aspect of my life to be sort of twisted. But those are all the things you have to consider. And here's another thing I'll tell you. To the extent where me or some of the experts on my team need to be called back, my fraternity brother and good friend, Greg, Councilman Greg, knows exactly how to contact us. We have lectures that we can, I think, deliver that are very scientific based, but we deliver them, like, for example, I use an IKEA analogy to explain how the virus and the vaccines work. So IKEA, just a department store. And to the extent where anyone's been to any department store like Target, you will completely understand the science around how the virus and the vaccines work. But it's like everything else that's good for you. You have to seek it, and seek and you shall find. But I think, starting here, .gov, local municipalities, and then people like myself who live and die this vaccine work. I mean, I do these every single night. My wife's not happy, but I will make myself available to the extent that I'm needed.
Thank you. I want to bring in our two council leaders again, Council Member Burnett and Council Member Johnson. I want to bring you both in for a couple, because we're running out of time. But I guess for me, in what we're hearing in some of the Q&A is if you all can speak to, what are you hearing from your constituent group, and how can we better, to Dr. Edie's point, inform, educate, get the information out from where you sit as council leaders representing districts. And just, I know personally you all are both in many other volunteer and community activities beyond your council role, and we certainly appreciate and value that. So you also have an additional perspective. What would you say to that? Let's start with you, Councilmember Johnson, then I'll turn it over to Councilmember Burnett. What would you say, and what do we need to be reminded of, and anything you want to address in this platform, because it's going to live on our platforms afterwards?
Thank you, Lamont. I think what's really important that I've seen and I've heard from lots of people is, and I think this speaks to what Dr. Edie was saying as well, sharing your positive experiences with it, but also sharing the negatives so that we can do better. But the positive experience has been key. I know folks who have talked, had that conversation with their parents who are in their 70s and 80s. That's something I think a lot of folks in their 40s and 50s have had to do the past few months. And it's a family, we do it together. It's like families getting together, having these conversations so that we can remind each other about that it's safe and that it's about keeping us out of the hospital and even worse. And so I think people sharing, and it has been a bit on social media, of course, but people sharing with each other about their great experiences has really impacted people's ability to feel safe and solid and empowered to get the vaccine, to jump off that fence. And so that has been a big theme I've heard from folks, cheering each other on, that we are in this together. And so we've all got to, at some point, enough of us have to get vaccinated for this to be something we can really crush, right? So that's been part of it too. And I think giving each other that little boost has been really helpful. So when you get vaccinated, it's your turn, go for it. And then boost others and take care of your family by, helping them get the information they need so they feel confident about this vaccination as well.
I like that, helping each other. Councilmember Burnett.
Thank you. I would echo those comments. I think, March of 2020, we were all talking to each other about what is this thing called COVID? How is it affecting, our families, our friends, and we started to see loved ones get sick and end up in a hospital, and even worse. And we talked and we communicated about what this thing called COVID was all about. And now we're seeing the same discussions going on as it relates to the vaccine. When you meet someone, you're like, hey, hi, how are you doing? Great. So what did you get? I got Pfizer, or I got Moderna. And you share experiences. And so word of mouth, just talking about it, is one of the best ways that I see that we're educating each other, because we care about each other and we want to share the information. We want to share our experiences. And that has proved to be very supportive in getting those in the community, as we stated on this call, off the fence to say, it's my turn to get the vaccine and feel safe so I can tell others the joy that I feel and share that with them. So I think it's about community. It's about communication and community.
Fantastic. Thank you, sir. Dan, I want to bring you in. I know you kind of mentioned it, but I want to make it a more of a bigger announcement. What can the city expect from the health department? I mean, you mentioned the bow tie, but you got to give it a little fanfare. This is pretty big. So let the community know, what can they expect from their health department under your leadership? Because this is fantastic.
Sure. So just want to repeat that, I feel like it's my job to make sure the vaccine is accessible to the community. My job is to bring the vaccine to the community and to reduce the most amount of barriers that we can. So that's why we're going to South Norwalk. We're going to the Sonoma Region Bowtie Cinemas to be able to be in the community, bring the vaccine to the community, and to be in a space where we can vaccinate many people. We can have big clinics and be able to vaccinate lots of people. And so we're trying to expand access, again, trying to bring the vaccine to the community. And we're also looking to continue to use our electronic health record, more and more to schedule, so that it's easier to use than VAMS is. We know VAMS can be challenging. So we're trying to do what we can do. We're continuing to get better every time. And we're really excited about this partnership.
Fantastic. Thank you, Deanna, to you and your team. Your leadership has been amazing and fantastic. So Dr. Eady, I'm going to close with you, and then we're going to turn it over to the mayor. We're running out of time, but just anything you would like to say to Norwalkers. Again, this is going to live on our social media platforms. People will be watching it, and we have seen our numbers go up and thousands start watching it. What's that salient point you want to hit for just to our community?
Yeah, so I mean, there's no better time now to save your and the lives of your loved ones. So let's just do it. Let's do it as a state. Let's continue to lead the country. Let's continue to be the gold standard and set the example. Listen, Norwalkers, I mean, you guys are blessed to have your mayor, and I think I'm remiss. I didn't say Deanna. I mean, she lives this whole vaccine equity and access, which are the two most difficult challenges I can imagine that she has related to the vaccine initiative in Norwalk. So I commend the mayor for putting together such a strong team. And since you've been blessed with all of that, the least you can do is bless yourself by getting in line and getting vaccinated. Thank you, and God bless you all.
Awesome. Thank you, Dr. Eady. To our council members, Burnett Johnson, our rock star, our leader, Deanna Diamore, our health director, Mayor Harry Rilling, always a pleasure to serve you. I'll turn it back over to you.
Well, thank you, Lamond, and I appreciate the panel being here tonight. I do see two questions on the board that I think are important. One, if Ms. Diamore can ask, when will people be able to sign up for the vaccine clinic at the movie theater? Do we know that yet?
So we're looking to start next week. I'm just waiting for the email from the state letting me know how much vaccine we're getting next week, but we're ready to go next week, and we'll be sending out more information. Please check the city social media on the website. Hopefully we'll have some good news to share soon about, when and how many, appointments we'll have.
Okay, great. Thank you. And one other question, is it true? And that's why we want to clear up a lot of information that's out there to see if information is accurate. Is it true that you need to wait 90 days after contracting the virus before you get the vaccine? Maybe Dr. Eady will answer that?
Happily, yeah. So that's a recommendation. A recommendation is 90 days, but you do not have to wait 90 days. I think when Dr. Fauci came out with that recommendation, he was suggesting that you don't sort of cut the line, if you will, and let other people who have not, because you have some antibodies, let other people who don't have any antibodies have access to the vaccine. Reggie Eady says, don't wait, get in line. And to the extent where Deanna has a vaccine for you, you need to get it.
Go get it.
Thank you. And I guess one last question, maybe already people who have contracted the virus and believe they have antibodies, they don't have herd immunity. I mean, they're not immune. They could probably still get it again. Am I correct?
Yeah, those antibodies don't last forever. And that's why I was given that example of the nameless person on the Quinnipiac. You can go to the website on the panel who had it twice. And then his testimony yesterday was, but he got in line as quickly as possible. And he thanks God that he was able to get vaccinated. So yes, despite whether or not you had it or thought you had it, because many of us think we were sick right around that time, but not confirmed to have COVID, you should still get vaccinated as quickly as possible.
Great. Well, thank you. There was one question that was directed at me or to whomever. The question was, has Mayor Rilling been vaccinated? The answer is that Mayor Rilling was not eligible till the middle of February. I felt it only fair that I wait until I was eligible, just like everybody else was. I got my vaccine February 16th. I had my second vaccination on March 16th at Bethel AME Church. I had absolutely no response to it other than a sore arm. There was no side effects. I didn't feel ill. I didn't feel itchy. I had no headache. So I'm telling you, my experience was absolutely amazing. And I do want to thank the people that tuned in. People tuned in as an attendee here. People that are watching on YouTube. You know, this has been a challenging time for all of us. And it's the experts like Dr. Edie, our team here in Norwalk, people that are helping us get through this, hopefully as quickly as possible. You know, folks, we've been at this for over a year now, and we're not there yet. We, like Dr. Edie said, we don't take our foot off the gas pedal right now. We still keep moving ahead. I always say that we're building the airplane as we're flying it. There is no manual on how to handle this, but we're trying to do the best we can, and we have the best interest of the community at mind. And I want to thank the members of the community that are serving on my task force. The volunteers are absolutely essential. You know, Greg, Councilman Burnett, and Councilman Johnson, and other council people and other people throughout the community have been there day in and day out at all our vaccine clinics. We couldn't do it without them. So again, thank you, Dr. Edie. You provided us with a wealth of information. I just encourage people again to follow the science, look at the science. And I want to thank Lamond. He's a great chief of community services. He does a wonderful job. He's here almost 7 days a week, and he's one of the most passionate people I know about his job. And thank Councilman Burnett, Councilman Dominique Johnson, and Deanna. And again, folks, we're going to do as much as we can to bring the vaccine out into the community. I totally agree with what Dr. Edie said about systemic cause of this vaccine hesitancy. It's not that people don't have the hesitancy, they just can't access the vaccine because of their schedules. So perhaps we have to look at, I know Deanna and Lamond are going to cringe at this. Maybe we have to look at an evening clinic or a Sunday clinic when the people are at church on Sunday. Somehow make sure we do everything. I see you smiling, Deanna. We have to make sure we do everything to get this vaccine to the public.
You went to a church.
So thank you again, everybody. Stay safe, Norwalk. Get your vaccine, and let's get rid of this thing once and for all. And we will be doing more town hall meetings to bring information out into the public. So again, thank you all, and good night.
Good night. Thank you. Thank you, everyone. Thank you again, Dr. Edie. Thank you, Councilman Burnett, for making the
Thank you all.
connection.
And keep up the good work, Deanna.
Yes, sir.
Thank
She
you
does.
so much.
Yes, yes.
Thank you, Dr. Edie.